To discuss this development, we're joined by Dr Angelique Coetzee from the South African Medical Association. Good morning to you.
Good morning, Jane.
Mixed messages, right? Safer there, now safer here. What is the safest thing to do?
The problem is that the WHO had sent out a communique that said they had advised against any unnecessary restriction of trade and movement between countries or in areas where there's an epidemic. The problem is that you cannot contain the virus. So that's the one part of the coin. The other part of the coin is that if it is my child staying in China under these circumstances, what do I do? So it becomes an emotional thing. For me as a parent, I would like to have my child back in South Africa. For other South Africans, it becomes what is your human right to be protected as well. So far, these students hasn't shown any signs of any of these diseases. I'm not calling them students, but it's not only students.
But mainly?
Mainly students. But, you know, there's a huge logistic infrastructure that needs to be set up to bring 200 people back into the country. And that can be a huge cost to us as well.
So where are they safer?
That is a difficult question. I think currently they will be safer in that province where they are. But again, it becomes an emotional thing. What do you do? So coming into South Africa, what the National Department of Health suggested was that they would be quarantined for 21 days. The problem with the 21 days in quarantine is that, you know, you can get an infection on day 20. Then it becomes another 21 days.
Okay, so they tell us that nobody has been infected, right? But I guess the danger is leaving there on the plane, who knows. Yes. How soon before you can pick up that somebody has caught the virus?
The average day that they have, or the incubation period, that period where the virus is in your body, and before, I'm going to try to speak in layman's terms, because I think we are speaking in our own language and half of the people out there doesn't understand. But for the virus to give you symptoms, the average time is about 5 days, but it can be up till 9 days before we can predict that you are having it. Then on day before you are having the virus symptoms, physical symptoms, before we can pick it up, it's not to say that I would be able with a swab or whatever to make sure that you're not infected. It's a very difficult virus to detect before symptoms occurring.
But 21 days should deal with it if any of them were to have it, even if you say it pops up on the second last day.
Yeah, you should be able, but remember there were lessons learned from the diamond ship as well, where people was declared after how long in quarantine, symptom-free and disease-free, and then the lady that went back to Australia was a super spreader. That's also something that we need to get out. The message out here to the public is that not everyone having the virus will spread the virus. So you get two different types of people. We call them super spreader, someone that just has the ability to spread this virus. And then there will be the majority of people will not really spread the virus that severely and that seriously than your super spreader. The problem is we do not know who is who.
Should South Africans be frightened of what's potentially on its way? And I should imagine we've got the threat from not only the South Africans coming back, but from all sorts of other avenues, right? And so if we are to be frightened, what can we do? Again,
remember, as I have said, there's no restrictions on trade and movement from countries, from the WHO side. So people are free to move. Yes, it's not if it's going to come. It is going to come.
It will.
It will. It is when it comes. And my concern out there, or Salma's concern out there, is that we are all speaking in all these nice ways and terms, but we're not telling the patient what is going to happen, what do you need to look at. Because it is important to understand that if you think you have the virus, that you cannot come into my surgery. I will have to triage you via telephonic system, via Skype, via any other communication platform that's available, except coming physically into the surgery. Then, as I have already said, about 80% of patients will have mild symptoms of a flu. You know, they won't even know that they have the coronavirus. It is symptoms like a bit of low-grade fever, body aches and pains, a running nose, a sore throat, a bit of cough. It's about 80%. It's important to understand that. Those 80% of patients, again, we do not know who is the spreader and who's the shredder. That's another thing that patients doesn't understand. As we are sitting here, we are shredding virus particles from our body. And so if we do not know who's who, and there is not enough protective gear at primary care level, also very important, protective gear, for me to see you, I would need to have the correct mask. Currently the mask that is the correct one for me would be an N95. It must be fitted for my face, cannot just buy one, and they are not available anymore. Patients need a 3-layer mask just to protect them a bit. It's not going to take the virus away. So I think I've got the virus. I need to phone my surgery. The secretary or whoever is doing the trials will ask you those questions. Depending on the severity of the questions, we will have you to self-contain and go home. Stay at home at least 7 to 14 days. There is no treatment.
Angelique Coetzee, thank you. It's pretty petrifying. I mean, good to get the South Africans home, but obviously we hope that all will be fine.